At Three Links Manor, some of our society's most vulnerable people receive the around-the-clock care they need to live out their golden years with dignity. But some long-term care providers say their entire model is in crisis, as more stopgap funding measures from the province end without a long-term solution in place.
I shudder to think about it, because in here, the care is so excellent, and some of them, you know, they would be absolutely lost.
The most recent COVID-era money being clawed back was dedicated to subsidizing pay for overtime and agency staffing, which Janice Boyle with the nonprofit Three Links Care Society says puts her in a bind.
It's really quite a catch-22 to describe, and it really surprises most people to learn about it.
Boyle explains that long-term care homes are mandated to provide at least 3.36 hours of care per day per resident. But with ongoing healthcare staffing shortages, that simply can't be done without paying overtime or contracting employees. And if they don't reach that level of care, the government will cut back their funding even more. As things stand, Three Links is facing an annual funding shortfall of $500,000. Something they characterize as an existential crisis they've been fighting to outrun.
Those COVID funds helped address a chronic funding gap, and we're funding that through our own ingenuity as a charity. We have cell towers on our roof that pay rent. We have housing for seniors, for low-income seniors, that generates cash flow.
Three Links Manor is putting off replacing its roof while it figures out how to overcome the deficit. Other facilities across the province are being faced with similar decisions.
This is going to affect everybody.
A report put out earlier this year by BC's seniors advocate Dan Levitt said that across the province's 5 health authorities, wait times for long-term care beds have already ballooned by an average of 335% since 2018. Industry representatives say this latest funding clawback will only make things worse.
The first impacts will be facilities that are not able to take new residents. That means that seniors who shouldn't be in a hospital or an emergency room are going to be there. That's bad for the senior. They decline. But it's also bad for other people who need to access emergency or acute care. We're already seeing those pressures, so they can't stand anymore.
The Ministry of Health was not available for comment. In Vancouver, Jack Rabb, City News.